The doctor has ordered the removal of a Davil drain. Which of the following instructions should the nurse give to the client before removing the drain? The client should be told to breathe normally. The client should be told to take 2 or 3 deep breaths as the drain is being removed. The client should be told to hold his breath as the drain is being removed. Or the client should breathe slowly as the drain is being removed. Right answer. The client should be told to take 2 or 3 deep breaths as the drain is being removed. Why? Because taking deep breaths will decrease the discomfort experiencing by the client during removal of the drain. Well, if you answer the client should be told to breathe normally, or the client should be told to hold his breath as the drain is being removed, or the client should breathe slowly as the drain is being removed, are incorrect statements because they do not decrease the discomfort during the removal of the drain. A 4-year-old is being tested for enterobiasis pinworms to collect a specimen for assessment of pinworms. The nurse should teach the mother to scrape the skin with a piece of cardboard and bring it to the clinic, or examine the perineal area with a flashlight 2 or 3 hours after the child is asleep, or bring a hair sample to the clinic for evaluation, or obtain a stool specimen in the afternoon. Answer. Examine the perineal area with a flashlight 2 or 3 hours after the child is asleep, because infection with pinworms begins when the eggs are ingested or inhaled. The eggs hatch in the upper intestine and mature in 2 to 8 weeks. The female then mate and migrate out of the anus, where they lay up to 17,000 eggs. This causes intense itching, so the mother should be told to use flashlight to examine the rectal area about 2 to 3 hours after the child is asleep. Placing clear tape on a tongue blade will allow the eggs to adhere to the tape. So the specimen should be brought in to be evaluated. There's no need to scrap the skin, collect a stool specimen, or bring sample of hair. The nurse is preparing to discharge a client who is taking a MAOI. The nurse should instruct the client to drink at least 8 glasses of water a day, or avoid over-the-counter cold and hay fever preparations, or wear protective clothing and sunglasses when outside, or increase his intake of high-quality protein. The right answer is avoid over-the-counter cold and hay fever preparation. Why? Because the client taking a MAOI should avoid over-the-counter medications for colds and hay fever, because many contain pseudoephedrine. Combining a MAOI with pseudoephedrine can result in extreme elevations in blood pressure. The answer, wear protective clothing and sunglasses when outside, is incorrect, because this too refers to the client taking an antipsychotic medication such as Toracin. And the answer, drink at least 8 glasses of water a day, is not specific to the client taking a MAOI, and the answer, increase his intake of high-quality protein, does not apply to the question. A client has been placed on the drug valproic acid or Depakene, which would indicate to the nurse that the client is experiencing an adverse reaction to this medication. Poor skin turgor, or photophobia, or visual disturbances, or lethargy. The right answer is lethargy. Why? Because lethargy could indicate hepatotoxicity. The nurse should also observe for jaundice, nausea, vomiting, anorexia, facial edema, and unusual bleeding or bruising. The answer, photophobia, poor skin turgor, and visual disturbances are not clinical manifestation of adverse effect of the drug Depakene. The client is having fetal heart rates of 100 to 110 beats per minute during the contractions. The first action the nurse should take is to apply an internal monitor, or get the client up and walk her in the hall, or turn the client to her side, or move the client to the delivery room? The right answer is turn the client to her side. Why? Because the normal fetal heart rate is 120 to 160 BPM. A heart rate of 100 to 100 BPM or 110 BPM is bradycardic. So the first action would be to turn the client to the left side and apply oxygen. So the answer, apply an internal monitor, is not indicated at this time. Maybe you have answered that. And the answer, get the client up and walk her in the hall, is not the best action for clients experiencing bradycardia. There's no data indicate the need to move the client to the delivery room at this time. So the answer, move the client to the delivery room, is also not correct. The nurse is assessing a client for hypovolemia. Which laboratory result would help the nurse in confirming a volume deficit? Urine specific gravity of 1.016, or BUN of 18 mg per dl, or hematocrit of 55%, or potassium of 5.0 MEq per L. The answer is 55% of hematocrit. Explanation for this one is that hematocrit levels are elevated with hypovolemia. The answer, potassium 5, or the answer, urine specific gravity of 1.016, or BUN 18 mg per dl, all of these are all normals. So potassium actually can be either increase or decrease with hypovolemic patient. BUN and specific gravity levels would be elevated with hypovolemia. The nurse should be particularly alert for which one of the following problems in a client with barbiturate overdose? Answer, hemorrhage, or apnea, or oliguria, or cardiac tamponade. The answer here is apnea. Why? Because respiratory depression is a sign of overdose. Other symptoms of overdose include seizures, shock, coma, and cardiovascular collapse. A client with benign prostatic hypertrophy has been started on Proscar finasteride. The nurse's discharge teaching should include instructing the client to take the medication at bedtime to prevent nocturia, or telling the client's wife not to touch the tablets, or explaining that the medication should be taken with meals, or telling the client that symptoms will improve in 1 to 2 weeks. The right answer here is telling the client's wife not to touch the tablet. Why? Because finasteride is an androgen inhibitor. Therefore, women who are pregnant or who might become pregnant should be told to avoid touching the tablets. The answer, explaining the medication should be taken with meals, is incorrect because there are no benefits to giving the medication with food. And the answer, telling the client that symptoms will improve in 1 to 2 weeks, is incorrect because the medication can take 6 months to a year to be effective. And the answer, instructing the client to take the medication at bedtime to prevent nocturia, this is not an accurate statement, therefore it is not correct. The doctor has prescribed excellent rivastigmine for the client with Alzheimer's disease. Which side effect is most often associated with this drug? Confusion, urinary incontinence, headaches, nausea. The answer here is nausea. Why? Because nausea and gastrointestinal upset are very common in clients taking acetylcholinesterase inhibitors such as Exelon. Other side effects include liver toxicity, dizziness, unsteadiness, and clumsiness. The client might already be experiencing urinary incontinence or headaches, but they are not necessarily associated. And a client with Alzheimer's disease is already confused. Therefore, the answer, urinary incontinence, the answer, headaches, or confusions, are incorrect.